Leading our organizations during a time of crisis, COVID-19. As the world was turned upside down by the pandemic, how have leaders in the community stepped up to meet the moment? Today we'll hear from the Chicano Federation and learn how they thrived during a critical time of need for their community. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, Executive Speechwriter with AHA. In this conversation, AHA's Dr. Leon Caldwell, Senior Director of Health Equity Strategies and Innovation, focuses on how organizations and leadership across the country have stepped up during the extremely challenging time of managing the COVID-19 pandemic. In this podcast, Nancy Maldonado, CEO of the Chicano Federation and affiliate member of AHA's strategic partner Unidos US, shares how the organization provided critical leadership in the San Diego community during the pandemic. More information is available at www.ifdhe.aha.org.
Thanks, Tom, and welcome, everyone. Today, I'm being joined by Nancy Maldonado, CEO of Chicano Federation. Thanks very much for taking time for this important conversation.
Of course. Thank you for having me here.
Well, there's been a lot going on in our world, in our country, so this is a great time for us to really reflect. And before our conversation, just please tell me a little bit about yourself, about the Chicano Federation.
Sure. So Chicano Federation is a 52-year-old nonprofit. We're located in San Diego, and we serve San Diego County and a couple of the surrounding counties. And really our goal here at Chicano Federation, we're an advocacy and social services nonprofit, and we aim to really invest in our traditionally under-resourced communities to make sure that they have the services and programs that they need to empower themselves and their families, and to really to build a better life for themselves and their families. And really we like to say that we are all about opportunity and making sure that all communities have the same opportunities to get ahead in life. So our programs are really centered around the most urgent needs in San Diego, which include affordable housing. We do subsidized or affordable childcare, early childhood education, and then we are also heavily invested in workforce and business development and helping particularly women to start their own businesses. We are also really interested in any programs that foster civic engagement. So last year we were really involved in census and voter registration. Voter registration is something that we will continue to be involved in. And then obviously over this past year during the pandemic, our response was really centered around our most impacted communities and making sure that they had the resources that they needed during this global pandemic.
Wow, that's impressive. I mean, you really are boots on the ground, as they say. Tell me about your role at Chicano Federation.
So I am the president and CEO here at Chicano Federation. I've been in my role for 2 years, so half of that has been during a global pandemic. But I've been at the organization now for about 4 years, and I came in as a senior director overseeing all of our programs.
And are you from the region? Is this a move away from home or return to home for you?
I'm not from San Diego, but I've been here for about 15 years. I am from California, so I've kind of made my way through different counties in California. So although I'm not from here, I definitely consider San Diego home.
Right. It's always good to have kind of local knowledge, but infused with kind of a broader understanding of context. So it's great. Well, congratulations on your movement through the organization and your leadership. So let's jump into the conversation. The coronavirus pandemic has been a crisis like anything we've ever seen. The unprecedented is the word that we typically use. It's required, us to think about how we've kind of transformed our organizations, our leadership style, and we place these extra demands on leaders to meet this very incredibly important moment, but one was fraught with tumultuous times. How did the pandemic affect your operations as a staff?
Yeah. So interestingly, we prior to the pandemic were serving about 10 to 15,000 families a year, and almost overnight the calls and the need doubled. And when the stay-at-home order went in place for California, obviously our staff went home. But once that was lifted, and we were considered essential workers because of the services that we provide and the categories under which we work. I got my team together and really had the conversation with them about how are we going to respond? Who do we want to be in this moment? And overwhelmingly, my staff said we need to act. Our community needs us now, they need us now more than ever. And so throughout this entire pandemic and throughout this entire time, my staff never worked remotely. They kept coming into the office despite having all of the same challenges that everybody else had, including childcare and risk of getting infected, all of those things. They made the decision collectively to continue to work, to continue to be out in the community. A lot of what we did was being out in the community, doing distributions, and obviously taking all safety precautions. But my team made the decision that we were going to step up at a time where in our community really needed us. And I have to tip my hat to them because they really led a lot of this work.
Man, what a profound leadership question. Who do we want to be in this moment? That's and I'm sure that's required you to shift some of your organizational priorities. You want to tell us about those?
Yes, absolutely. So, we continue to operate the programs that we run, but we had to pivot. We had to shift the way in which we did it and shift the way in which we were there for our community. And we weren't able to go into people's homes, which is a lot of what we do, but we were able to transition and make sure we were doing that remotely, right? Make sure that all of our families had computers and had Wi-Fi and were able to navigate whatever systems we were using. And interestingly enough, there was a portion of our community that never stopped coming to our office in person because they didn't operate and they didn't want to connect on the phone or virtually, and they wanted to keep coming to the office and talking to people and getting service in the way that they were used to. And I believe that we have to meet people where they're at. That's what we're here to do. We're here to serve. We're here to help. And so we continued to do that. We continued to see people and families and made sure that they knew that we were here. Obviously, we did it a little differently in terms of people had to make appointments. There was, we had all sorts of safety measures in place to protect our staff and to protect the families. But it really shifted the way that we did everything, including all of our services and including the way that we interacted with the families that we serve.
What a great example of really demonstrating culturally consistent service delivery, in the moment. So one of the things that's, as we think about communities and your service delivery to your community and being really focused on meeting people where they are, how has the community needed or wanted or really collaborated with you to navigate the pandemic and the recovery?
Well, one of the things that we did to make sure that we were, to your point, collaborating and really serving in the way that we needed to, is we started asking the question from early on, what is it that you need from us and how can we best help you in this moment? Originally, so we have affordable housing. Our seniors, a couple of our properties are for seniors, and that became our first priority. And so we made sure that they were home, that they had everything that they needed, that we were delivering groceries to their doorstep so that they did not have to leave. And that came as a result of us asking them what they needed. And so I've been really adamant about always saying that just because I represent a certain community doesn't mean I speak for them, and that we need to continuously ask people what it is that they need or how we can best help in that moment. And we have continued to do that throughout the entire pandemic, which has shifted the types of services and programs and assistance that we have been providing. At one time it was cleaning supplies. Early on we saw that there was a shortage of cleaning supplies. And a lot of we have a number of different programs in childcare. And so our child care providers were not able to get the cleaning supplies to clean their child cares and continue to care for the children of the essential workforce that needed to be at hospitals and at grocery stores. So we had to act quickly and find a distributor who would sell us cleaning supplies in bulk so that we could then distribute them to our child care providers and keep them open, right? So it was just listening, asking the question, listening, and then being responsive to those needs. And so much of this was unintended consequences, right? Who, as you were buying your cleaning supplies, who would have thought, like, gosh, there's a child care provider out there that probably needs these. So again, it's being willing to ask the questions, being willing to listen, and then respond in an appropriate and meaningful way.
That sounds like almost a recipe or a roadmap for like really successfully engaging communities where they are, which is kind of your entire framework, if you will. And in this moments that we've had over the pandemic and even with its recovery, can you tell me a little bit about what is it like to actually like listen or ask the question first and then listen and then shift from just a management perspective? Like how do you get an organization that may have been 5 years doing one particular thing and not really listening to others, and now all of a sudden it's in this crisis moment where it sees an opportunity and it has to do something different? What does that require from a leader to shift like that?
That's a great question. And I think it requires the ability to be agile, right, and to be responsive. But I think it also, I had to earn the trust of my team because as we all saw, we had to pivot so many times during this pandemic. And that's hard. That's hard on people, mentally. It's exhausting. And so from a leader perspective, I had to have the trust of my team for them to trust that these pivots were necessary and that, we were doing the right thing. And a big part of it, too, is I'm a firm believer that I will never ask my team to do anything that I wouldn't do. So every distribution, every time we were out in the community, everything that we did, I was there front and center every time. And I think that that's so important to show them that, that's how much I believed in what we were doing and then the response that we were providing, that I was right there every step of the way with them. And I have had a number of my team comment on that, on how, touched they were by that. And when I mean I was there, I don't mean I was just, showed up and, like cheered everybody on. I mean, I was there doing the work. And I do remember a few of my staff commenting on, wow, you really don't have to do that. And I disagree with that. I think that as a leader, I did have to do that, especially in that moment, right? Because I was asking my team to do things that were potentially putting them at risk of contracting the virus, right? Because they were out in the community. And it just would not have been fair or right, or, would have been, like in that moment, it wouldn't have showed leadership if I had not also stepped up and done the same thing.
You also had to gain the trust of the community, not just your staff, but those people who your staff was assembled to serve under, the mission and vision of your organization. What were some of the strategies that you used to really help your constituents, your consumers, your partners, your collaborators trust you in this moment?
I think a lot of that came from us asking them what they wanted, right? And not just assuming that we knew, and then being responsive to those needs. For example, there was a time where people were saying, we really need diapers, right? Like they're very expensive. And right now when people aren't working, that's something that we need. We had an entire semi-truck of diapers shipped to one of our preschools and just distributed boxes of diapers from there. So it's those little things, right? While that might not seem like a big deal, the fact that we heard and responded, I think, helped us to earn a lot of the community's trust. It also goes back to that this organization has been in San Diego for 52 years, and it's a trusted name, it's a trusted resource. but we also doubled the number of people that we served. We didn't turn anyone away. So if people came to us and they weren't enrolled in our programs or had no affiliation with our organization, that didn't make them ineligible to receive whatever services we were providing, whether that was gift cards, financial assistance, rent relief. We made our services eligible to anyone.
Yeah, when I was in high school, one of my favorite words was indolence. I'm not sure why it was my favorite word. It was one of my favorite words. And I thought about it, at some point, they just say indolence incites ingenuity, right? And you just gave me another phrase, like crisis catalyzes creativity. And this whole kind of crisis we were in and the whole country's been in, and how you responded to and being really creative and thoughtful and kind of deep in the community's needs, and really listening and kind of morphing into an organization that was more responsive with less resources is quite commendable. What were some of the other obstacles that your organization had to overcome during this time? We know that the resources piece was significant. Trust was something significant. Was there anything else? Did you get pushback from elected officials? Were there any messaging and communications that were kind of problematic or challenging, or opportunities for doing something different out there?
Yeah, absolutely. So, specific to the COVID-19 infection rates and deaths here in San Diego County, we started to sound the alarm on those pretty quickly, because what we saw is, early on in the pandemic, while Latinos make up about 34% of San Diego County's population, at that time, Latinos were accounting for like 62% of the infection rates, right? So very disproportionate. And we had to be very vocal about that and start talking about it and saying that we need to be doing more, that our elected officials need to be doing more. And that's always a risk when you're calling out, elected officials and, calling people out for their lack of response. And at that time, no one was really doing it here in San Diego. And, since then, obviously, no one was doing it for the Latino community, I should say. And so we did have to take a stand, and we did have to start speaking out on kind of the unequitable response or inequitable response. And, it was a risk, and there was times where we absolutely got pushback, and that was okay, right? Because we had to remember who we were going to be in this moment and always come back to that. And so, it turned out fine, but there were moments where it certainly was, we didn't know what the outcome was going to be. We didn't know how our message was going to be received. And then, also you asked about the messaging and the communications. I mean, that was part of it, is that, from the beginning, we were very vocal about there not being enough information in Spanish, that all of this communication that was coming down, because it was coming down rapidly, wasn't getting to the communities that needed it the most. And, making sure that we were serving as that platform or that conduit to make sure that message from our communities was getting amplified. And that's really the role that we wanted to play in that moment. How do we amplify people's concerns, their needs, their messaging, and make sure that the people who need to hear this are hearing it? So, it was through the media, through all sorts of different channels that we started speaking out and amplifying that message.
You remind us that the disproportionate impact of the pandemic, and it's still ongoing, it hasn't stopped, has had on the Latino immigrant community. There was a study published by the Journal of Annals of Epidemiology found that Latino immigrants between the ages of 20 and 54 have been 11.6 times more likely to die from the coronavirus than those born in the United States. The disparity is connected to overrepresentation in jobs that involve person-to-person contact, among other things as well. What has your organization done to help combat these disparities? What could hospitals or health systems do better to eliminate these disparities? Any thoughts on that?
Yeah, so to the first part of that, what we did to combat some of these disparities, again, it was twofold. Through our advocacy efforts, we started advocating for different assistance, right? So, for example, there was a time where there wasn't financial assistance being offered to an essential worker should they contract COVID-19. A lot of the times with the community that we serve, this could have been the sole income earner for their family. So if they got infected, what was that family to do? And so, those are the things that we started advocating for in order to protect our community and in order to ensure that they were getting the resources that they needed. And as the pandemic went on, we saw that start to shift. We saw that there was financial assistance being offered. We saw that, here in San Diego County, at some point, the county started offering hotel rooms so that this person could go stay at a hotel away from their family and not risk infecting them. So a lot of that came through advocacy. The other part is that we were actually on the front lines providing PPE to our entire community. At some point we put together COVID-19 safety kits, which included every different type of mask for adults and children. They had thermometers and, with the batteries, they had the oximeters, disinfecting wipes, like all of the things that you would need to kind of protect yourself from COVID were in those kits. And we made it an effort to raise some of those funds, and then the county provided some of those funds. And to this date, we've distributed probably close to 30,000 of those kits. So, being on the front lines, providing that PPE was a big part of what we did. And then to your second question about what hospitals or health systems could do to kind of start to address some of these disparities, one of the first messages that we started putting out to our community was to have a healthcare home, to have a medical home, right? If they didn't have a healthcare provider, to contact us and we could help them identify one and locate one. Because as we saw in the news, a lot of times what would happen is that if someone started to develop symptoms from COVID-19, they didn't know where to go because they didn't have a healthcare provider. They didn't have someone that they trusted. And so in order to kind of try to get ahead of that, that's the message that we started to send out. But again, during a global pandemic is a little too late to be sending that message. So I think in terms of what we can do better, especially as hospitals or health systems, is to start to build that trust. Like, let's not lose sight that this was a barrier during this pandemic, and let's continue to build the trust, build the relationships, be in the community, get to know the community that you serve, and help them to establish that medical home before they need it. That message, I think, alone could really help to change the way that people think about healthcare and to think about the health systems. And then also, like I said, really understand the community in which you serve. One of the things that that we give some thought to is the messages that we put out. So for example, with the vaccine right now, the message that people hear is, if you experience side effects, contact your healthcare provider. But how many people don't have a healthcare provider? So again, if we understand, if we really meet people where they are, then the question should be, do you have a healthcare provider? And if you don't, can I help you to find one in the event that you have symptoms or side effects from this vaccine? And I think that if we shift the way that we think and shift the way in which we talk to our community and really make it a opportunity to build and earn trust, that could have a profound effect on how people view healthcare and our health systems.
Wow, that was really rich, Nancy. Thank you so much. One thing you said that struck me is this idea of having a healthcare home. And I think about, there's one thing to seek a home, but it's another thing to go to a home that's welcoming and comfortable and all those things that we think about as a home, as a refuge to some extent, and particularly for healthcare. So for, our members who are tuned in and who will listen, is one thing when we can advocate for, our friends and family and our community members to have a healthcare home, and as the Institute for diversity and health equity. Part of our job is to make sure when they do arrive at that home that it is a welcoming place where they can get the best services they can get. So Nancy, thank you so much for your time today and for sharing with us your very inspiring leadership during the COVID-19 crisis and all you've been doing for the San Diego community. Thanks for listening. For more information from the Institute for Diversity and Health Equity, please visit our website at ifdhe.aha.org. Until next time, peace and progress.